York State, we spend most of our healthcare dollars in the last 6 months of life. Most people in New York die in hospitals, whether they want to or not. Our technology has given us the opportunity to do lots of wonderful things that prolong the dying process but don't address any issues around quality of life. My personal story, I have two stories about both of my parents. My father is dead well over 35 years, long before laws got involved in end-of-life decision-making. And he was a person that if you couldn't guarantee him full recovery, he opted to not have any treatment at all except to manage his pain. And he was dead very quickly. On the other hand, my mother, who's dead now about 7 years, she drew her line somewhere entirely different. For her, every moment of life was something special. So we had a wonderful opportunity to talk about what she would desire. And though she was very sick for 5 years, my sister and I were able to implement all her wishes. And at the end of her life, she died in our arms. So it was both sides of the same coin. The people and end-of-life issues is about a continuum. It's about personal choice. The challenges in discussing it are manyfold. With most lay people, certainly my generation, older, maybe even a little younger, it's as if you speak about these issues, something bad is going to happen. And so keep them unsaid, and then whatever will be, will be. In the professional community, the hardest discussions are about end of life. When there's a life-threatening illness diagnosed, a progressive life-threatening illness, most physicians and others in healthcare, nurses, social workers, it's the hardest discussion to have. And we're not educated and trained in being able to put aside our own belief systems and meet patients and families where they're at. In New York City, it is very important. We are probably the most diverse city in the world. I was recently in Vancouver, I was recently in Seattle, and I longed for the diversity of New York. But with diversity comes challenges. We all grow up with belief systems around health and well-being and illness, and who defines suffering, who defines quality of life, who defines the issues between religion and science. That's the challenge we face every day.